The correct use of the insulator is a key part of therapy. If the person does not use it or uses it incorrectly, will harm therapy or void its results. The insulator interrupts the harmful vibration that comes from the contaminated groundwater vein. Healthy people may use the insulator. Its use is paramount for anyone who are or have undergone therapy. It is not for a limited period use. The insulator must be used for life, and it should be used wherever a person remains still for a long time in relation to the ground on a routine basis. Next, we'll give instructions and they should be followed to the letter. Every detail is important. So, however you do not understand why some detail, follow the guidance to the letter. If you have any questions, always consult your therapist. Remember, this is a moment we have no time to lose, so we must carefully follow all the guidelines to try to get the possible results as quickly as possible. The Insulator CK, also known as large insulator, must be used in bed and other locations where the person stays put, standing, sitting, or lying down during long periods with regard to the floor, such as bedroom, living room, dining room, TV room, balcony, workplace, computer usage, mobile, etc. Each person should identify their daily habits and set the local need to use the insulator. The insulator must always be used inside the undyed cotton cloth bag that comes with it. If you lose or damage the bag, look for an AEMK therapist to get another bag. The fabric and thread used for making the bag are tested for compatibility with the insulator. The use of other tissues annul the effect of the insulator. Use wooden bed or divan bed adapted with a foam, spring, pocket spring or viscoelastic mattress with preferably light-colored fabric. Avoid dark and dull colors. When in doubt, use white or cream. The same recommendation regarding mattress colors applies to sheets. Do not use iron beds, beds with drawers, or spare beds under the bed. The space between the bed frame and the floor must be empty. Do not store underneath the bed things such as shoes, metal parts, tools, electronics, and other things. Not even between the bed frame and the mattress. Things such as paper, wood, documents, X-rays, test results, and so forth. Do not use mattresses with magnetic plates or orthopedic plates, old or damaged mattresses, or mattress covers. In bed, the CK insulator inside the cloth bag must be placed directly above the sheet, next to the body, at the height of the center of the person's chest. Whenever you use the bed to rest, or even watch TV, place the insulator on top of the quilt or duvet. Place the CK insulator inside the cloth bag on the seat, in the space between the legs, or against the backrest, however you feel most comfortable. Do not sit directly on top of it. Use wooden or plastic chairs. Several models of office chairs are compatible. Give preference to the simplest ones. The sofa must have a wooden structure and the lower lining must be removed, just like the divan bed. Do not use chairs, armchairs, or sofas with metal structures. The recliners must have a wooden structure and pay attention to the foot support. It should only have metal on the side handle. Those with a complete metal structure do not work. The long stay in the toilet bowl is harmful. When prolonged use is for pleasure, some people tend to use mobile, read magazines, crossword puzzles. This habit should be eliminated. If it is because a disease or a treatment or drug side effect, the insulator must be used in the following way. Place a small light-colored plastic pot with holes on the sides, upside down, exactly next to the toilet, and place the insulator on top of it. Do not use any type of magnet close to the insulator. They prevent it from functioning while they are near it. Both insulator and cloth bag must be washed on a weekly basis. Wash it with steel wool pads and detergent without glycerin. Do not use scouring pad. Get a piece of steel wool pad, soak it in water. Wet the insulator. Put neutral detergent without glycerin on it. Clean the both bigger sides and the 4 smaller sides of the insulator. Rinse it well and dry it with a napkin, paper towel, or a clean piece of cloth. Put the insulator where you were using it immediately in the correct position by using the spare cloth bag, which is clean and dry. Put the cloth bag in a glass of water and detergent neutron without glycerin and leave it to soak for 30 minutes. Do not use bleach. Scrub it and rinse it thoroughly to remove all grease and detergent residues. Squeeze and place the cloth bag over a paper napkin and leave it to dry naturally. Do not sun-dry it or ironing after it is dry. Wrap it and store it for using it next week. The recommended is that the patient himself does the insulator's cleaning. If not possible, make sure the person in charge of doing it has done correctly. When starting therapy, remember that the insulator must be washed before use, and the cloth must be washed a week later at the beginning of the weekly cleaning of both. That is it. Thank you for your attention. Follow the guidelines and always count on us.